This is Sarnia-Lambton Daily for Friday, April 3rd. Good evening, I'm Terry Doyle. Ominous projections from the province of Ontario today. Medical experts are forecasting between 3,000 and 15,000 deaths due to the COVID-19 pandemic, with health measures that are currently in place. Without any steps that have been taken, experts say deaths in the province could have hit 100,000. Today's update was to encourage the public to continue physical distancing and other measures to keep the numbers down. The model suggests Ontario could have 80,000 positive cases of COVID-19 by the end of April, while without physical distancing measures, that number could have been more than 300,000.
And today, you saw some drastic numbers. These numbers are stark and they're sobering. They tell a story. These numbers tell a story of Ontario's fight against COVID-19. And the reality is, the early chapters of our story have already been written. And there's some things that are out of anyone's hands. But what matters is that the ending of our story is still up to us. And if we work together, we can write the last chapter of our story. Because these forecasts are projections. And they can change with your actions and with the government's actions. We've seen today that we can lower these numbers. We can slow the spread and flatten the curve. But as it stands, by the end of this month, we could see as many as 80,000 people in Ontario inflicted with this terrible virus.
Local Medical Officer of Health Dr. Sadit Ranade weighs in on the provincial modeling.
It's important when you hear those things or read through them or see what's been released that you recognize that there's two, or at least two, but probably more sources of data that we think about. And one is models. And the thing about models is that people put in estimates and data that they've gathered, as well as assumptions. And models can look very, very different based on what data you enter and what assumptions you provide to the model. So the second thing to do is to think about not just the model, but also the health system evidence that supports whether or not the model is playing out on the ground in reality. So it's important to think not just about what the model says, but also the picture that's developing in the healthcare system in terms of ICU admissions, emergency room admissions to the floor with respiratory disease, and those kinds of things, which we will all be paying fairly close attention to over the next couple of weeks.
Coming up later in the show, we will hear from Sarnia-Lambton MPP Bob Bailey. Elsewhere, Sarnia Transit is making changes to the service. There had been previous reports buses were being used for non-essential rides and users not adhering to physical distancing standards. Well, to get an update on the changes to Sarnia Transit service, Andrew Savor is the transit superintendent. He joins me now. And Andrew, fill us in. There are changes coming up here to Sarnia Transit. What are the changes?
So beginning on Monday, we're moving to a Saturday bus schedule. Now, what that means is that we will have the same number of buses on the road Monday to Friday as we would on Saturday. However, our service starts at the same time as it would on any regular Monday to Friday, which is at 6:30 in the morning.
So basically what we're looking at indeed is the quantity of buses and the routes being run is what people who are normal riders would see as a Saturday schedule. The difference is starting at 6:30 in the morning. And I've got to think that was a bit of a balancing act as you came to that decision.
It's a bit of a balancing act indeed. There are a couple of factors driving this decision. The first is staffing shortages. And the second is the primary control group in the cities at the direction of the Sarnia-Lambton Public Health Office to ensure that we're providing essential travel only while maintaining social distancing.
Now, are there a couple modifications to the Saturday schedule that people will now see Monday to Friday?
Yeah, so there are three typically. Our Saturday, or our regular passengers will know what the Saturday schedule is. So we'll have 2 Route 9 buses. Typically we have 4. Monday to Friday we'll have 2, and then the Route 43 bus service won't be operating, and also the Route 6 Mitten bus will not be operating. I should add that 2 things. One, the Route 10, which typically operates Monday to Friday, will continue to operate as it does normally. It does not operate on Saturday and Sunday. And the second thing I would add is that there is no current change or planned change to the weekend Saturday, Sunday schedule.
So that's where we stand right now for Sarnia Transit. And I'm sure that's the thing you found right now, is trying to maintain this as an essential service and emphasize the word essential for people that absolutely need the service for work, especially essential workers, or those people maybe that have to go out and run a quick essential errand. But I guess the message right now is essential trips are the key.
Yeah, essential trips have been defined as most of your viewers in the public know, as trips to a medical appointment, for instance, or a pharmacy for essential medication, groceries. People need obviously to sustain themselves, and for essential work. What we've noticed over the last 2 weeks is that there has not been much of a decline in passenger trips. So we're monitoring passenger trips on a daily basis, and unfortunately we're not seeing much of a decline.
Has it been a challenge as well to maintain physical distancing, not only for the driver of the bus, but obviously because the bus is the venue, keeping passengers apart?
Just like many cities across the province, but also Canada, Sarnia Transit has implemented a number of measures to ensure that we try to keep our employees safe while encouraging passengers to maintain social distancing. The first of those measures are rear door boarding. So we don't have any passengers board via the front door unless they have some mobility needs. But even most of our buses are equipped with a rear ramp, so we can facilitate mobility requirements through the rear door. The second thing we've done is we've eliminated fares. So we've not collected fares for approximately a week and a half. So there's no need for passengers to walk from the back of the bus to the front of the bus. And the third thing we've done is we recently placed some caution tape near the front of the bus to try to maintain some distance between passengers and operators. We still encourage passengers who absolutely need to ask questions, but we ask that passengers do that at a safe distance. And lastly, I would say we've posted some notices in the bus. These notices encourage passengers to cover their mouths with their sleeves or a handkerchief or something else if they, in the event they have to sneeze or cough or have some other concerns.
Is it also a message for the public, as you and I are talking to, as someone who does get on the bus for an essential reason, to find a spot on their own somewhere on the bus? Hopefully there's lots of room on the bus because not many people are riding, but at the same time just respecting your fellow riders, knowing, okay, if someone's sitting in row 2, for lack of a better term, go sit in row 5. Just because it may be a little different, you don't have to sit right at the door. Your stop will come and everything like that, but definitely respect your fellow riders when it comes to physical distancing.
Yeah, absolutely. That's an absolutely essential point. We encourage people to think proactively when they're sort of seating or positioning themselves where to sort of sit on the bus. That's a fantastic point. What I would also add in terms of, I think you mentioned respecting fellow riders, is that if your trip is not essential, please reconsider taking your trip, or take your trip at a time when, in the mid-afternoon when ridership is low. Everybody that takes a non-essential trip is taking an essential trip away from somebody who has to get to work for essential reasons or needs other essential items. So we ask people to consider that. And the third thing I would say to people is, please really seriously consider leaving earlier than you would normally. We expect that given our ridership numbers, that it may be a little bit more difficult to board buses. Once our buses are sort of full, if you will, or at capacity with passengers, our operator is going to be instructed to bypass bus stops if it is not safe to have additional passengers on board. We will make provisions to accommodate people that have been left behind as a result of a bus being at capacity. We will make provisions for picking those people up also with another bus. But we are encouraging people to leave some extra time to get to their essential destination.
Andrew, before we let you go, has this been a little bit of a learning curve when it comes to being agile, which is a term a lot of us are using when it comes to changing things? But here it is, having a service where discouraging people to a certain extent from using the service probably isn't something that a year ago, 6 months ago, 6 weeks ago might have been in your vocabulary.
Yeah, absolutely. The learning curve is quite broad. Our ability to remain agile, to use sort of your word, is incredibly important, and to remain open in terms of having to make changes on a daily basis. It is difficult, but it's essential. It's difficult in the sense that to change constantly requires a lot of work and a lot of effort and so on, but it is essential, and that's certainly our focus, and that's been the focus, as I know it, of the primary control group in the city, is to remain as agile as possible, to receive as many updates as possible, and then to make changes based on the information that we have, the best information at any one time.
Well, Andrew, we appreciate you taking a few minutes with us, and please stay safe to you and your entire team. We appreciate the work they're doing, certainly providing an essential service, and once again we emphasize essential to the residents of Sarnia.
Yeah, thank you, Terry. The last piece I would add is I'd like to add also my thanks and commendation to all the essential workers in the city, not just the emergency services like police and the fire department and the hospital workers, but also the transit workers who are doing an excellent job in to put it mildly, adverse circumstances.
Absolutely. Great words as well. Thanks, Andrew.
Thank you. Have a great day.
That's Andrew Salvora from the Sarnia Transit, the transit superintendent. Just a quick recap there. Starting Monday, Saturday service schedule will be in place for the most part. There'll be a few modifications to that, but it will start at 6:30 in the morning. Stay tuned. More to come on Sarnia-Lambton Daily on your TV. Welcome back to Sarnia-Lambton Daily. Well, we turned into a little bit of a regular segment here. Fridays with Bob. Let's go out to Petrolia now, where Sarnia-Lambton MPP Bob Bailey joins me now. Bob, how are things out in Petrolia on this Friday?
Well, it's a beautiful sunny day here in Petrolia, and I'm encouraging people to socially distance, of course, that hockey stick apart, but get out and get some fresh air. Or even if you just sit on your deck or out in your yard, it's a great time. It's dry enough of it, you can get out and do some yard work, and I'd certainly encourage people to do that while they socially distance themselves from their neighbors and others. But it's a good day to walk the dog and things like that. But yeah, there's a lot of information that's coming out. Earlier today, the Premier come out with the doctors and people that he interacts with day and night, and unrolled what he hears every day from the doctors. And he said, why I'm not sleeping at night. So I'd encourage people to follow the media reports as they roll out earlier today and again tomorrow and tonight, where you see where the Premier brought those results out to people. And I think what his idea on this was to reinforce again the importance of people to take this for serious, like especially in the larger cities where maybe people have more. Maybe they're not, what would I say, they're not practicing the distance issues that they're supposed to. So the Premier wanted them to see where we're at, where we could be if we practice the social isolating and social distancing, and where we could and will be if we don't. So it's all up to each and every one of us to, like they said, you're not stuck at home, you're safe at home. And I've been trying to emphasize that on any of the media I do, that you're not stuck at home, you're safe at home. So remember that. Stay in touch with loved ones by phone, by Skype, by any format you can.
We've seen over the time of this pandemic a lot of provincial programs being rolled out to help various organizations, help various sectors, and a lot of times these programs would go through a lot of consultation, public meetings, obviously talk among ministers and yourselves in cabinet, I'm sure.
Yep.
This is a whole different time, and I'm sure it's now a case of trying to make the best decisions for people where the need is.
Yes, and that's what the Premier and the cabinet and of course all of government are working on this 724. I know the Monty McNaughton, I talked to Monty 2-3 times a day, and he's on cabinet calls till 10 o'clock at night. The Premier's on the phone at midnight. I hear him talking to the Deputy Prime Minister as late as midnight, trying to put issues together, solve problems for people that need equipment, ventilators, etc. So yeah, it's an all of government, all of people in the public service. I want to reach out and thank the public service, both here in Sarnia-Lambton and across the province. And when I say the public service, I mean the municipal employees, provincial employees, Service Ontario, Service Canada, and others, that are reaching out. I know my office is still in touch with people. We have our website, Bob Bailey, Sarnia-Lambton, all one word. And I'd encourage people to go there if you have questions. There's lots of postings there of different government programs, and I'd encourage people to use that as opposed to the telephone, because it takes time, to go through all those calls. So we're still having phone calls to the office, and there's messages on there for people to, for unemployment insurance and different federal programs. We try to sort those out before people leave a message. Then we have to call them back and say, look, sorry, that's not our area. So we don't want to give people a runaround. So we changed that message to reflect that. But I've urged people that have the ability to go to social media, Bob Bailey, Sarnia-Lambton, and access that. But when you talk about just one example, it was announced earlier this week to Sarnia-Lambton, to the Social Service Department, who's doing such a great job here through the county. Social Service, we received $2,816,000 in new money. Now that money is going to go, because they know they're going to have issues with homelessness, people needing more money to, buy food and drug services and medical services. So that money will be administered through the county, through social services. And that was specific new money, $2,816,000 to the Sarnia-Lambton community. And I want to shout out to those folks. They're doing a great job there. I know, and another group that's doing great work is Miles Vanny and the Salvation Army through their food banks and through the Into the Good Shepherd, etc. I know that they've seen increased donations because of the publicity, and that's why I wanted to mention it again today. Anyone that can could give, please reach out to Miles Vanny. That link again is on our website as well, and to the Salvation Army. I know there's been recently some large donations by our corporate people here in Sarnia-Lambton. Well, I'll name two of them. I know CF Industries and, of course, Kilgore. Both of them made recent donations, and I would encourage other industries that can to do the same, because it'll all help in the end. So I want to applaud those industries and, of course, those two social agencies out of many.
When people hear of announcements, of course, if they hear an announcement Tuesday, they're hoping the money rolls out Wednesday. There is a process. Of course, you try to get rid of as much red tape as possible, but is that where sort of maybe passing along that, hey, just a little bit of patience? I know it's a nervous time. We've seen that with federal programs as well. I know that's a different area, but still, I guess, is that where, when in doubt, if money can go to organizations that are already administering these services, it helps kind of cut out the middleman?
And that's why the province has chosen to do what they're doing. These people are already on the ground in the case of 2 or 3 of the agencies I mentioned already, whether it's Ontario Works and Social Services through the county, the End of the Good Shepherd, the Salvation Army. The people that administer these programs already know the people, they know their clients, they have a whole process in place. It's not like, why rebuild the whole industry when we have those people in place? They just need some help, and that's what the province is trying to do. And I would encourage everyone to reach out, work with them as much as you can, and of course listen to your media. I want to applaud the media, yourself in general, your TV, and of course all the local media, whether the dailies or the weeklies that are trying to keep us informed as they can. Social media, we're all in this together, and at the end of the day, if we all do our part, we'll come out of this together as well. And I know the local business, if you can, support your local industries, like local grocery stores, of course, are doing well. I mean, I know, and I want to say those clerks and the people that are filling the shelves are doing a yeoman's job under tremendous pressure, and I want to applaud them right now. And make sure when you do go in, if you have to go in person, thank the person that's bringing your food through, because they're out of their home and safe environment to keep the rest of us fed. And I want to make sure we reach out and thank them. And also, something else that's very important is the truckers. I know Monty raised this issue, Monty McNaughton, about the truckers, and I think that's coming around now. A number of industry or businesses have opened up their restrooms and their for grab and go meals, because the truckers, I mean, let's face it, they're the unsung heroes. I call them the knights of the road, because they're working 7/24, delivering food, delivering drugs, delivering pharmaceuticals, etc., to our businesses to keep the community going. So if you see a trucker, say thanks, wave at them on the road. If you're out for your self-distancing walk, make sure you wave at them. But they're doing a great job. There's so many people. I mean, I know I missed somebody. You know, I've talked to the doctors recently. They've called me with suggestions, what they want me to communicate back to the Premier. Appreciate what he and the government are doing. And so, you know, those doctors, the nurses, the orderlies, the people that are doing the janitors, keeping the rooms clean, keeping the floors hygienically clean in the hospitals, the people screening people at the assessment centers, everyone. I hope EMS drivers, of course, that are going visiting people in the home.
That's always been your thing from day one, as in this role, as people helping people. And I know one area you wanted to touch on before we go is those people at the grassroots level that are helping each other when it comes to grocery pickup and picking up some groceries, leaving them on the front porch for people that are either working in healthcare or the seniors who probably shouldn't be out at the grocery stores right now.
Yeah, there's some major programs going on. I know in Corunna, Petrolia, Wyoming, and in a nutshell, and you need to call your own grocer and find out, but I know there's people packing groceries inside, so you can either order online or phone in your order, and there's no need to even go in the store if you're a senior or if you're a healthcare worker, you're concerned about, you know, either exposing someone or, you know, picking up something from someone yourself. So they pack the groceries for you. You make the arrangements with the store through your credit card to pay for them. And you pull into the parking lot, call in. They bring the groceries out to your car. You pop the trunk. They put them in. You don't have to change any money. They'd rather you didn't. And then you drive away, take your groceries home. So I want to really encourage people to take a look at that for seniors, for people in the healthcare field, the healthcare industry, doctors that could be working 12, 14-hour shifts or longer, nursing people as well. And, you know, maybe they're living alone or maybe they've self-isolated and, you know, so they don't bring something back to their own family. So it's a program out there, and I want to applaud all the grocery stores and the social agencies, and you know, I know there's a number of groups like I shouldn't name any of them, all the Optimists and the Rotary there too, I know of, and I'm sure there's many more that are helping with these groceries, either packing them or bringing them out to your car or delivering them to seniors who are either quarantined at home or have come back from Florida or some vacation and are following the guidelines to stay in for at least 2 weeks. So I'd encourage everyone to take a look at that program and take advantage of it. It just is less traffic in the stores, even if you're healthy, but it would save. One of my family members called me the other day, and she had taken advantage of it. She said, it was great. I don't know whether I'll ever go back to shopping again. She said, it's so simple. So anyway, I think when we're all done with this, there's a lot of things that are maybe in society what should be done in the past, which could dramatically change. Hopefully all for the better.
Well, Bob, we appreciate you joining us here. Stay safe out in Petrolia. We'll check in with you again next week.
Yeah, thanks again, Terry Doyle and your TV for all the great work you're doing. And thank you again. I look forward to talking to you again as soon as possible. Thank you.
Thanks, Bob. Before we go tonight, a non-COVID-19 update. The Ontario Hockey League will hold its annual priority selection, or their OHL draft. Coming up tomorrow, the Sarnia Sting will pick 3rd overall. North Bay is choosing 1st and already announced they will select Toronto defenseman Ty Nelson. Be sure to watch the Your TV Sarnia and Sarnia Sting social media channels over the weekend for updates. And while we will not be back with you on Sarnia-Lambton Daily until Monday, of course, we will keep you posted on breaking news locally, nationally, and provincially on our Your TV Sarnia Facebook and, of course, Twitter channels as well. That's going to do it for Sarnia-Lambton Daily for this Friday. Please have a safe weekend. We will see you Monday.